Over the past 25 years, I've performed more than 12,000 hip and knee replacements. Using the anterior approach, I've had only 4 hip dislocations in 19 years. Recently, patient number 4 walked back into my office. 7 months earlier, I had performed her second total hip replacement. That surgery actually became memorable for me, not because of the outcome, but because the insurance company denied payment for my professional services after multiple appeals. The surgery center was paid, the anesthesiologist was paid, the implant company was paid. I was the only member of the surgical team whose professional fee was denied. 7 months later, after an unusual injury that occurred during massage, her hip dislocated. Fortunately, it was reduced successfully in the emergency department. But if instability reoccurs, revision surgery may become necessary. So here's the ethical dilemma. She is now outside her 90-day global period. This would be an entirely new episode of care. She's, of course, asked me to perform the revision if it's needed because she trusts me. She believes that I'm the best surgeon for her. I've already operated on her twice. I want what's best for my patient, but I also know that there is already a documented history of my professional services for this patient being denied reimbursement despite the procedure being medically necessary and successful. So I find myself asking the question I never expected to ask. How should physicians balance their ethical obligation to patients with a payment system that can selectively refuse to reimburse medically necessary care? This isn't about whether or not I'll take care of my patient. I will. It's about recognizing that insurance decisions don't affect physicians financially. They inevitably influence the physician-patient relationship by inserting financial uncertainty into decisions that should be based solely on clinical judgment. When enough physicians conclude that this uncertainty is unsustainable, they leave insurance networks. Patients ultimately pay the price through reduced access to experienced surgeons. I'm genuinely interested in hearing perspectives from physicians, administrators, attorneys, insurers, and patients. Where do we draw the line between professional duty and a reimbursement system that increasingly shifts financial risks onto physicians? When insurance companies refuse to reimburse medically necessary care, they aren't just affecting physicians, they're changing the physician-patient relationship itself. If enough surgeons decide the financial risk is no longer sustainable, they don't stop operating, they'll leave the insurance network. And patients, well, they're going to lose access. Follow NAOCA if you want to have conversations about healthcare that nobody else is willing to have.